A chickenpox outbreak at a medical facility in St. Catherine drew the anger of chairman of the Municipal Corporation's Health and Sanitation Committee, Sidney Rose, on Thursday. Not because of the outbreak itself, but what he deemed an unconscionable response from hospital authorities. Krista Campbell has that story.
A health situation unraveling behind the walls of the Linstead Public Hospital in St. Catherine that's caught the attention of chairman of the Municipal Corporation's Health and Sanitation Committee.
But there's an outbreak of chickenpox at the Linstead General Hospital since last week Friday, Saturday. And several persons, to include medical and non-medical persons, has contracted chickenpox.
The committee chairman said a clinical staff member relayed what is happening at the hospital to him. But what has him disgruntled is how he said the management of the facility is responding to the affected staff members.
They have asked these persons, these medical, clinical persons, or let me say clinical persons, to pay for the vaccine, which costs $9,500. And listen to me, and I'm not speculating, it is the staff to pay $9,500, and the staff had to, strongly resist. And they say, well, if you can pay 30%, then we'll pay the rest.
Mr. Rose stressed such a response is in poor taste because the staff would have contracted the disease on the job while taking care of patients with chickenpox.
What matters worse is that they are saying the 5 days that they have been given is not part of what they would have gotten for their sick leave. How could they ever say that to the staff members?
He says the sick days are apparently being taken out of the medical staff's regular sick days and in any event do not nearly cover the 7 to 14 days it takes to be healed from chickenpox. This was Deputy Chief Public Health Inspector for St. Catherine, Denise Douglas's response to the chairman's concerns.
The Linstead Hospital chickenpox outbreak, that matter was brought to our attention and it is being investigated as it relates to the staff not getting adequate sick leave or on the 5 days they're being granted. That is a function of HR and I cannot speak to that.
Krista Campbell, TVJ News.